Brazilian butt lift. Is it worth doing it? How are the results? Is it that dangerous? Hello friends, I am Dr. Ankit Gupta. I am a plastic surgeon and I practice in New Delhi, India. And today I'll show you a case of Brazilian butt lift that we did a few days ago, and I'll address all the questions regarding Brazilian butt lift. So Brazilian butt lift or fat grafting to your butts is a very commonly done procedure these days. In this, what we do is we harvest fat from your own body. We take out fat from either your back, your tummy, your thighs, or whichever area you want to reduce fat from. And the most common area is your flanks and your tummy area. From here, we harvest all the fat, we collect it in a sterile container, we process it, we centrifuge it, we collect and separate out the good fat, and that good fat is injected into the area where you want to enlarge or you want to enhance. For example, your buttock area or your breast area. So in this case, I'm particularly showing you a case in which we have taken out fat from her back, from her arms, from her tummy, and all this fat we have processed and then used to inject into the buttock area. Now many a times I get patients who would demand to get a very huge BBL in which they would want to enhance their butt by a large amount. But here is the problem. There's a limit to which we can enlarge the butt which is safe. So what happened earlier was that usually plastic surgeons used to inject the fat into the muscles, into the skin, into the subcutaneous layer, and everywhere in the buttock area, and this fat used to travel through the bloodstream into your lungs and would block your lung vessels and thus cause problems. Now, to be on a safer side, we never inject into the muscle. We only inject below the skin in the fatty layer and never into the muscles. In this area, there are no blood vessels, no major blood vessels where this problem can occur. So for her, we took out fat from her back, from her flanks, and this would make the waist narrower. This automatically enhances the buttock area. This fat is then transferred into syringes which are again sterile, and then it is injected into the buttock area. As you can see in this patient, this is immediately on table how she looks, how the buttocks have changed. You can see the waist is much narrower compared to the before, and the buttock area is much wider compared to before. This also helps in getting you an hourglass shape. Such a surgery is very commonly asked for in African women as they prefer such a shape. These surgeries are very common in Indian patients as well. They do not want the buttock area to be enhanced as much, but yeah, they do want a hourglass figure which looks very pleasing. So in short, if it is done in a limit, if it is done by a professional, if it is done under safe circumstances and a limited amount of fat is grafted into the buttock area, it is a very safe surgery. If you have any other questions regarding Brazilian butt lift or fat grafting to your buttocks, breast or face, we will be happy to help you. You can always ask us or contact our team and I will be happy to help you. Thank you and have a nice day.